Hello, everyone. Welcome to a new edition of Cannamonitor webinar. This edition, I'm very excited about. We are talking about concentrates. We are doing that a couple of weeks after 7 of July. So, the 10th of July, the day of cannabis concentrates. And we have Peter Nel, which is a great person to talk about that, because he's the founder and the CEO of GES Labs, which is a South African extractor and producer. And he was, quite honestly, one of the pioneers of the solventless space in international medical cannabis, I would say. So, Pete, how are you doing today?
Very good. It's a little bit cold in Cape Town because it's winter here, but very, very good.
Yeah, and before going into it, well, I know you are a chemical engineer, and you founded the company when you were still in university, or you haven't even finished your studies. So may I ask, how did you see so soon? Because now in the last few months we are seeing a lot more talks regarding the shift to extracts and the shift to solventless. But I remember you were one of the first that was on LinkedIn talking about that. So how come that you had this idea so early on?
Look, I think sometimes the most obvious things are too obvious to actually just be obvious, right? And so when you just look at the dynamics in North America, in Canada, and especially South Africa, which has a very ripe cannabis culture from a decriminalization perspective, locally, we had a huge live rosin boom, massive. So I looked at the information locally and I said, okay, well, if this is happening in South Africa and it's happened in North America, we are definitely going to have this in the international market. And so it was really just about saying, okay, is this possible from a regulatory aspect? We went to look at the regulatory guidelines, the kind of EMA kind of herbal supplement manufacturing guidelines, and said, yes, this is possible. There's things like drying, freeze drying, washing, all that sort of stuff. And we said, this is definitely possible from a regulatory perspective. Let's go all in, basically.
Okay, amazing to know the story. So, like always, we have 1 hour and we have quite a packed session, I must say, with many different topics that we are going to cover on international markets like Australia, Germany, the UK. We're going to talk about concentrates, but also vapes, also edibles, and also on the supply side economics. And as I said, Peter is the person, he's the man to talk about that. So I'm very glad having you. Everybody that's following us, remember that we will have a Q&A session at the end. So write your questions on the chat, because those are the ones that we're going to be asking in the end. We have a very packed session. So without any other preamble, let's go straight into it. And to set the tone a little bit, of course, the big explosion in the international medical market that we have had in the last few years was so concentrated on the flower, right? So Germany last year exported 205 tons of flour, and this was 90% plus of the demand in the market. And we could say similar things on Australia, the UK, and the other emerging markets internationally. But now there's this idea that this is starting to shift. So I want to ask you, Peter, do you agree with this sentiment that we are starting to see a shift to the extracts? And if you think a little bit into the future, 2 years from now, 5 years from now, do you think the market will have shifted towards the extracts? And also within the extracts, will it still be dominated by the distillate-based products? Or do you think there's going to be a surge of solventless?
So this is how I look at it. You have to ask this question. What was the platform for flowers to be prescribed by doctors? Very simple. You needed a medical device. The stores in Pickle Mighty Medic. If there was no Mighty Medic registration, there would be no flower market, because the doctors would not be able to prescribe. End of story. We have now 2 medical registered devices for inhalation extracts: the Curaleaf, QMed device, and the Aero pod. That is the platform. So you've got to think, okay, here's the platform for prescriptions to actually legally happen. That means it's going to go, and there's going to be basically prescriptions going to extracts. That's a very simple hypothesis and assumption to accept. The next thing is to say, okay, well, where does it go in the next 3 years? I believe it goes very fast to 1 in every 3 prescriptions being an inhalation extract based on the North American data. That is a very strong hypothesis that we have, and assumption that we are actually building our business around.
That's super interesting. Of course, we had last year in California, the Vapes overtook the flower as the main category. It also happened in some other markets, like in Washington. And as markets mature, they seem to be trending in this direction. So let's look into the data. Like, what does it tell us about what's the current shape of the concentrates market? And to look at it from the beginning, I would start with a little ontology of how I think of the landscape of cannabinoid extract products, and also to gather your input if you see it in the same way. So of course we have what we could consider the solventless category, which traditional hash historically produced in areas like Morocco or Lebanon would fit in this category. So this includes dry sieve, but also bubble hash, and of course the king of the solventless, which would be the rosin, which you pioneered. Then we would have the hydrocarbon extracts like butane or propane, which is what we consider resin products, and there's so many varieties of them depending on the consistency and specific and the specific process. And then finally we have the extracts, which have until now dominated most of the menus in medical markets in particular, because those are the methods. Ethanol and CO2 were the methods more established in the pharmaceutical industry, and also perhaps producer economics were favoring them to a certain degree. So most of the oral oils that you could find in medical markets were extracted with ethanol or CO2. So we have this type of extracts, but then the concentrates would be the part of the extract market that you dispense, let's say, as such, as a concentrate, not dissolved or not in a ready to use format, such as a vape, etc. And they account more or less in mature markets in North America, which is always our reference, about 5% of the value of sales, which is therefore quite a niche category, I would say, more on the premium end. But of course, as Pete was mentioning, the vapes, which of course can have need to have an extract inside, are also a big driver of the demand at the wholesale level for concentrate products. So when we look at, of course, every North American market and even Canadian province can be a little bit different, but one big difference that we see between the two markets, and here I need to caveat a little bit the origin of the data, because one is by the Ontario Cannabis Store, whereas the other is secondary data by industry platforms. But we see that the Canadians or the Canadian menus are a lot more focused on what they call traditional hash products, which do not need to be solventless in this context. They can also be a little bit formulated, but at least they resemble these traditional forms like Afghan hash, temple balls, etc., etc. Whereas in the States, we see a little bit more of the hydrocarbon varieties. So here I need to ask you, Pete, if you agree with this ontology, let's say, and do you think that we can get any learning for the international markets based on what has been happening in North America?
Definitely. I think I would say North America more so than Canada, because Canada, has a unique kind of culture on cannabis and the way that the kind of legal Ontario store, for example, manages the concentrations, etc., like that. But I just want to touch on one topic here, is that the type of extraction technology, whether it's ethanol, hydrocarbon, or solventless, the reality here is that all you're producing is a base molecule. Yes, there is nuance to say that some process will preserve some terpenes and some processes are better to make a THC distillate versus a THCA isolate. But the reality here is that on a like-for-like basis, at a cost perspective, it doesn't necessarily always matter what end product you make. For us, obviously, we're saying here that if you can actually produce solventless at scale and produce the right base ingredient, you're actually able to go to all categories and you're not actually just fixed on that niche category. That's just the one nuanced thing. And I think for me, the North American market really does show a lot of trends with what's happening, especially if you look at North America and Australia. The trends are very close together.
Mm-hmm.
Except except on orals. I would say there's an anomaly on orals in Australia.
Okay, and we'll later touch on that. So thank you for bringing that up. And we must say that the solventless shift is also registered in North America. So I believe unlike the vapes, which have been, as we mentioned, taking off immensely over the last few years, the concentrates category has been more or less stable, at least in share of the market. However, within, of course, the secret is always in the details. And when we look at the rosin and the solventless categories, they are definitely still growing even in North America. Yeah. So that's very interesting. What of course when we look at the concentrates, there's two main metrics, let's say, that we can put them in the market. And in this graph, we are showing the menus available in these 4 international markets, let's say Canada as a mature reference that we always take, and then in Australia, the UK, and Germany. We have in the vertical axis the price in US dollars per gram, and then in the horizontal axis we have the average potency. And we see, I believe this graph is quite interesting because we can assess a variety of trends. So first we see that on the top, on the highest price per gram, we have markets that have just opened up, including the UK. The first references for concentrates in the UK were just launched a few weeks ago. And, the hash available there starts at 40 pounds per gram, GBP per gram. So quite a high price in comparable terms. And even if you compare it with the legacy market in Great Britain, for sure. And a little bit of a similar thing we could say on Germany, and even if we compare Australia with Canada, which of course it's not a one-to-one comparison. We have the GMP process internationally that doesn't need to. The standard in Canada is GPP, is not quite as pharmaceutically strict, but still we see that there's some room to. For commoditization to happen, let's say, from the top of the chart towards the bottom. But something else that I believe is interesting is the difference between the price of what they call traditional hash and the price of rosin, because we see that there's a certain premium always at play in Canada, in Australia, even potentially in the UK. And this premium seems to hold quite a bit even as the market matures. It's true that the steepness of the curve between the two seems to be reducing a little bit as it goes down, but maybe you could expect this. But there's a strong premium that holds between different categories of solventless products, which I believe is interesting. And then again, if we look at Canada, where we have a lot more references for, let's say, wax or resin-based products, is that some of the more potent products have a little bit of lower prices than the live rosin. So in the flower market, even though of course everybody wants to value their flower depending on their production process and depending on other aspects, but we see that THC is so determining, so relevant for the price. There's a very strong correlation between the potency and the price. In the concentrates market, this will lead me to believe a little bit that perhaps there's some process elements that go beyond this basic correlation of price and potency. But here we have the expert, Peter. Do you think this is the case necessarily, or do you think it also matches the flower trend of that what both patients and also B2B customers are looking for is potency, regardless of process, in a way?
Yeah, 100%. I think fundamentally, just to speak to the slide here, right, you can see the UK live rosin and the Australian live rosin, the red circle and the yellow circle. The red circle is much far higher than yellow circle. I'm in both those markets and I supply them at the same price, right? So you can already see here that it's really just about process and market maturity. The UK market's very new to this, and so the price is obviously at a scarcity level, right? So you can see the Australian price is way down. Now, the thing about potency, right? Potency products at a concentrate level here, at an extract level, you can see the Canadian shatter and the Canadian diamonds. In our perspective and our honest view is that the market, especially in Canada, from a pricing perspective, is so thin because of the tax that those products, by definition, have become byproducts. So they're actually selling byproducts. They've got trim, they've got old flour, they've got products that couldn't really sell, and they're just cleaning them up and reformulating them, knowing that the consumer or patient, whatever they are in that market, are looking at a potency versus price decision. So there becomes a very clear formulation perspective, even at a concentrate level, to make sure that you put in a potency versus price product out there, whereby a live rosin product, which is by definition a product itself, it's never a byproduct, especially if you're actually growing for whole flower, you are very much limited by biological constraint of that process in flower. So you always be biologically constrained from a live rosin perspective. So it starts to form its own category of positioning from a price perspective, which means that your supplier or the way you get it to the market is incredibly important compared to the rest of those byproducts.
Okay, very, very interesting comments here. So then, if you had to guess, what's your guess on the likely evolution of all of this? Do you think that live rosin can get to the same low prices as, let's say, the diamonds necessarily, or not quite, because as you are mentioning, it's its own product it's not just a byproduct?
I believe it can easily get to the same the same price as those other products, but it itself won't actually stand the potency game. So therefore it reaches the ceiling, because it can't compete on potency, but it can compete on price. It reaches a market saturation on potency. So therefore you've got to be a bit smart, which we can talk about, I think, in the slides coming up.
Okay, very interesting. Very interesting. Yeah, so let's look a little bit more in more detail at what the current menus in international markets are composed of. And of course, we see that first, we are not talking about massive menus. As we mentioned, some of these markets, they opened up very, very recently. Germany, it was last year, but with very limited references. Pretty much the two live rosins by Demecan and a couple of other hydrocarbon products, mostly now in recent months, these syringes to fill the cartridges, given as Pete was mentioning, the fact that now we have some medical devices that are suitable for the inhalation of extracts. In the UK, this was even more recent. It was end of May or beginning of June that the first references appeared in the market. And Australia, is true, it has a little bit of a deeper history, and we saw a few dozens of these products, and in also the markets, let's say, are a little bit idiosyncratic in the sense that we see differences first in the origin of the products. So for instance, UK for now, it's in the pure concentrate category. It's true in the vapes, there's a lot of products from South Africa, same as in Australia, but let's say Canada remains dominant as an origin. So this is why maybe we see a little bit more similar menus between Canada, Ontario in this case, and Australia, compared to, for instance, Germany, that we see them a little bit, with distillate syringes and other things that are due to the particularity of the magistral process in Germany, by which you cannot just supply a whole cartridge already filled. No, you need to have this process in the pharmacy. But of course, Pete, you are supplying these three markets, so you are very well attuned into the differences. So in your view, how do you think the menus in different international markets compare, and how do you think they will look in let's say over the next year or so?
So I believe Australia and the UK will mature to a very similar position, 100% very similar position. Although I think there will be some nuances in the types of products people are buying in the UK specifically. That's because in our world, the UK is very much a fashionable market. So therefore, luxury goods becomes very important. So we'll start to see things like premium hash live rosin. There's already a huge Californian kind of Thai influenced concentrate black market in the UK. So in terms of the live rosin culture there, very, very, very strong compared to Australia, where they are very far away to actually have a kind of live concentrate kind of cannabis culture. I think with Germany, due to the fact of the magisterial preparation and including the EU-GMP Part 1 live rosin definitions of the product, right? So particularly very interesting about Germany is live rosin is considered a medicinal product, which means you have to have EU-GMP Part 1, which is what we just went through, for example. Now, you can't just sell a THCA product, right? It needs to be decarboxylated to Delta-9. So there's a bit of a risk on the pharmacy. How will this actually be prescribed, like with what Democan is doing with the medical device and the Mighty Medic, versus getting a decarboxylated rosin product? So in our view, we believe the growth of decarboxylated rosin in Germany, by definition of the regulatory framework and the compounding steps, will be much greater than the live rosin opportunity for the German perspective for the time being. So we'll see the UK, I believe, will have a very high luxury good live rosin concentrate market compared to Australia. So we think that the hash rosin market will be much bigger in the UK in terms of opportunity size than Australia. We think Australia will lean more towards Ontario, like the Temple Balls, but we think Germany is going to be having a massive growth on decarboxylated rosin, especially in these ready-to-fill syringes and these medical device cartridges.
That's very interesting. Can you explain a little bit more, because perhaps some of our viewers don't know exactly the difference? What do you mean with decarboxylated as opposed to live rosin? What's the difference in the format, and what can you use one that you cannot use the other?
So the decarboxylate, the normal live rosin, let's call it THCA live rosin. That's what everyone knows, the concentrate. They sell it in the 2 gram and the 3 gram and the 1 gram kind of little jars, right? That's a acidic form concentrate product, THCA, like smoking flower. That product has to be used with a device, whether it's a Puffco. You know, in Germany, it's currently being prescribed with the Mighty Medic. We've done some experiments. It can be used. The results are fine. The difference with the decarboxylated is really, in our world, we have specialized technology where we take this peanut butter looking product, you know, it's kind of viscous. We'll put it into the pressurized reactor and we'll decarboxylate it. So actually convert the THCA to Delta-9 THC, which is basically got a monograph. So Delta-9 actually has a monograph in the European Pharmacopoeia, for example, and it is a controlled substance that can actually be prescribed for medical benefits, right? So this is well described, Delta-9 THC. So you take the live rosin concentrate, you simply heat it. We use a very low temperature, so we take it to about 70 degrees Celsius on a long time under inert conditions, and you basically just transform it from this peanut butter-like substance into a very kind of non-viscous, you know, almost like free-flowing distillate, basically.
And then this can be formulated into oils, or what's
formulated into edibles. It can be formulated into orals. It can be formulated as is into a medical device cartridge. So it's a really useful product. So in our world, what we see is hundreds of pharmacies in Germany receiving bulk decarboxylated live rosin amber jars that they can use to make orals or medical device for inhalation.
Okay, very interesting, very interesting. So an API based on live rosin for the manufacture of these advanced dosage forms.
But what's very, very, very critical here is due to the definition of any rosin-based product in Germany, they consider it a medicinal product, so you have to have EU-GMP Part 1. Whereas distillate is considered an EU-GMP Part 2, as an example.
Okay, so I mean, but Part 2 is the API and Part 1 is finished product. So you're saying that live rosin in Germany, to be supplied to the pharmacies, it needs to be as a finished product?
100%, exactly.
Okay, interesting. And something else that caught my attention regarding of what you said is you talk a little bit about the history of the different like let's say the scenes on the legacy side in the UK as opposed to Australia, for instance. So do you think that familiarity plays a role in the products that are more demanded by patients in these different markets? Like, is the fact that the British patients or the German patients are already used to Moroccan hash for decades, do you think this plays a role in the future of the market?
Huge role. And you have to go spend time in these markets to really understand. Now, South Africa has a decriminalized market, right? So we have a very, very mature decriminalized market, like Spain, for example. So when you have this decriminalized market, it gets influences from around the world. And even our market was heavily influenced by the European kind of hash culture, but then even more so the North American live rosin culture. So you can kind of see, okay, when you have exposure to a specific type of culture use of cannabis on the black market or gray market or decriminalized market, that very much influences the local demographic use behavior.
That's very interesting, but I might not push back, but just okay. I had let's say a tendency in favor of solventless products until I saw some pure resin vapes for the first time that weren't available in Europe. Or
I think I was with you when you actually showed me them. I think I was with you in London when you had them.
Oh yeah. It's true. We're in this party, in a vape party, actually.
Yes.
So yeah, that was surprising to me, and saying, okay, these products haven't been available in Europe, but if you can get them into the market, do you think that Europe would trend the North American markets in this regard, or do you think they will stay true to what patients are more used to?
So it's a very interesting topic you bring up, cured resin, right? Because I had some Canadians come to our facility a few months ago, and we showed them a product that we make, and we called it something completely different. And they said, no, this process of you making this product like this is actually called cured resin. And I was like, okay, well, explain that to me. Well, you see, the flower is cured. So therefore, when you make a kind of CO2 extract from a cured flower, we kind of call that cured resin. And then we add the cannabis-derived terpenes to the product. So in our opinion, a lot of it comes down to marketing and kind of nuance. And especially if you hold the extraction knowledge that I hold, for example, the patients and consumers don't genuinely know a processor's head, right? So, there's a lot of these interesting nuanced naming conventions. Like, everyone sees liquid diamonds at every single garage in America. I can guarantee you that 99% of that's distillate. You see? So it's really an interesting topic here when you come with an unregulated marketing perspective into a regulated pharmaceutical supply chain. It's where there's no definitions in this extraction market. It leaves room for people to decide, okay, well, if we call it this, who's going to really know? And so that's where we see the biggest gap right now in this market is people actually don't know the definitions. So every time I actually have a meeting with a potential client, I actually put a slide up and I say, these are the definitions of the products. This is what they actually mean.
Yeah. This could potentially be a problem. The fact that you have a lot of incentives, perhaps, to sell products as live rosin, when in fact they are only in a small part formulated with live rosin, perhaps, if you're lucky, or perhaps it's even a completely different substance.
Exactly. But that being said, I believe that Germany will protect the price and product nature of live rosin.
Regulatory-wise, or the
regulatory-wise, there are very few companies in the world that have gone through a bee farm EU-GMP Part 1 inspection, where the bee farm inspector has actually been to site to audit a live rosin process. Very few companies, probably 2 in the world, and we are probably one of them. So that being said, from that experience, I genuinely believe the live rosin industry in Germany will be protected and very difficult to get into, and therefore extremely exciting for those involved.
So that's your moat.
There we go.
Very, very interesting. Okay, let's keep going. I want to cover the topic of the vapes, which, as we discussed, the concentrate is sold as a concentrate. It's a very exciting category, but relatively more niche and premium, let's say. But the vapes is what in North America is becoming a big part of the market, and there's a lot of potential as well in Europe and in Australia in these international medical cannabis markets. No, and what we see is that perhaps because we are coming later we are more early in the maturity cycle, but we have already seen what happened in North America. The new trends can take hold faster, perhaps than in America. So we see, for instance, I believe the data point in America, according to some data providers, is that 42% of the vapes are already like rosin or resin based, as opposed to distillate, which is 62. And we see that Australia is already at a similar point, maybe a little bit less mature, but trending towards in this direction. And a similar thing we could say regarding the offering in the UK. And Germany is a little bit special because it was so gated by the lack of devices. Now it's starting to open up, but I need to say as well, in the UK, the first rosin vape was supplied by yours truly. So congratulations
Thank you
for that. But this hasn't yet arrived in the German market as such. I know some pharmacies are filling, but not in the same way as in the UK. So what do you think? Do you think that distillate will remain the cornerstone of the vape market due to producer economics and all of that? Or do you think that we're going to continue to see this switch towards more premium concentrates inside these vapes? And also within the concentrates, if we look at this slide, we already see, for instance, that Australia, pure resin or live resin is a little bit more prevalent than solventless, whereas in the UK, perhaps because they are getting supplied so much by South Africa, but we see that apart from one Aurora SKU, I believe, which is pure resin from Canada, I believe many of the other vape SKUs in the UK are live rosin from South Africa. So Pete, what's next for vapes in the international markets?
Okay, so very interesting topic, right? So you got to understand the category of the vape product market. So first, it's potency and price, right? The next thing that's important is flavor. The next thing that's important is then only process and then only brand. So you got to look at distillate right now. Now, in our opinion, it's the potency versus price question. It's also, there's, in our opinion, also a surplus of this product available. So it's taken quite a big chunk of the market. But where we believe the UK market, for example, goes, we believe it goes 35% rosin and 65% distillate. But to nuance the distillate, where we actually think the long game is here, where the end game is liquid diamonds. We believe, and we can see this in North American data, we believe that when you bring a liquid diamond product at the right price to compete with distillate, you capture all of the distillate. And that's because of potency versus price. Rosin, like I said, will have its ceiling, and it won't go more than 35% because it cannot become more potent because of its product biological constraint. However, if you want to look at the North American game and you want to speak to what destroyed or what captured the distillate product, it's liquid diamonds, because you can compete on potency and price. So I think distillate loses in the UK in the next 12 months.
Very interesting.
Because,
what do you think?
Because the market's so small, right? The market is really small. So if a company decides to come and bring 50 kgs or 100 kilograms all at once to United Kingdom of liquid diamonds, for example, which will be the same price as distillate, I believe you wipe out the entire distillate category in the UK. Yeah.
And you think this is mostly based on the basis of potency?
Potency. It's the same as flour, right? Once the wholesalers and clinics and everyone understood the potency versus price dynamics of purchasing with patients and prescribing, they understood that if you take that same lens with vapes, it 100% translates. Yeah.
Interesting. And what about Germany? Because we were mentioning the specific the difficulties to bring these products, and actually the concentrate category in Germany is a little bit boosted by the syringes that we were mentioning that are not intended as a dabbable, but rather as a to fill the cartridge, which is not the case in finished product markets like the UK and Australia. And we see that the only products, well, most of the few products that are in the market are distillate based, and a few that are hydrocarbon based. The ones by Becanex, which are now getting filled into the Curaleaf devices as well. So, well, you were mentioning that the live rosin is a finished product going into the pharmacy. So then, can this live rosin in Germany be used to fill a cartridge as well of a proprietary device, or what do you think
Yes.
is the future of vapes in Germany?
Yeah, so it's an interesting one. I think our hypothesis is that distillate will actually do very well in Germany for the next 2 years. We've got a 2-year view on distillate in Germany for the next 2 years. We think it goes through the distillate, the resin kind of life cycle for the next 2 years. We think live rosin comes in very fast, similar to the UK, but we believe that distillate does very strong. And in our opinion, that's because there are quality, ready to sell EU-GMP Part 1 distillate manufacturers in Europe. So we know that for a fact. We also know that, for example, Curaleaf has a vertically integrated supply chain with the device and able to sell distillate. So we think distillate stays with the patients in Germany specifically for a long time. Now, that being said, the live rosin will catch up, specifically just because, we are entering that marketplace. So our products will be, available for prescription. But I just think, just due to the nature of where the market is, the players involved in the market, and what they've kind of built beyond from a marketing perspective, it holds its price and position fairly strong for the next 2 years.
Very interesting. And something else to comment here. It's not a webinar on vapes, but still, device is of course highly relevant as well to its success. And we saw, for instance, in the UK, even though there's now these medical devices that are approved, but we see that 510s persist. And also this new approved device. Same as in North America, the all-in-ones. So this means like disposables that you can charge. Essentially, those are the segment that's growing the strongest. Whereas in a place like Germany, it's a little bit more complicated. It's true there's one for already a couple of years now, these breezy vapes by Bloomwell that are 510s, but it's just a external packaging, the 510 cartridge. But some quality persons maybe don't fully agree with this. A lot of people think that you need to have a medical device approved. So Pete, how do you think this device conversation will impact the future of vapes in the different markets, and is this relevant as well to what's the type of concentrate that goes into the vapes?
Yeah, so let's take a bigger zoom out here. Let's just take a big zoom out. Let's look at society in general from a non-combustion perspective. The IQOS device from 2014 to today, which is the non-combustion cigarette device, right, has grown 133%. It just keeps compounding. The growth is enormous. While cigarette use is down, I think, 30% year on year, right? The same with cannabis flower. It's down 30% year on year. But then nicotine vapes and cannabis vapes are growing between 23% year on year and 52% year on year. So you see this phenomenon globally where non-combustion is a trend that's going out of fashion, right? Then you just wrap that into the industry that we are in. So with that lens and that view, you say, okay, well, there's going to be a lot of innovation in the 510 because of nicotine, IQOS, all this non-combustion stuff. So a lot of innovation is happening in that space, which means that, in my opinion, you will continually see the development of these all-in-one devices, these medical devices, the 510s. And I think ultimately what it becomes is the standards of all these companies just get to the same bar, and we just see a wave of innovation of regulated devices enter the market. So I think what we see now is a lot of unregulated devices enter the market, and they will catch up simply due to the CAGR growth of non-combustion globally as a total phenomenon. Yeah.
Interesting. And do you think a thing like a dab rig approved as a medical device could greatly propel the category?
So put it this way, we did a study with the Mighty Medic, right, where we took live rosin, we put it onto the little stainless steel sponge, and we put it through a smoking machine, and we did the tests, and we kind of said, look, this is actually very suitable. We've also got a decriminalized market, so we can actually just go buy a Mighty Medic here in the local market and test it with live rosin off the black market as well and see if that experience is good. And it's good enough. So the fact that it's good enough, and there is live rosin in Germany with the Mighty Medic, and it hasn't really boomed yet for who knows what reason. I think that market's always going to be niche, to be dead honest. I think if you look at the consumer trends in North America and the innovation of these hardware, I mean, you're going to laugh now. But in North America, the deciding factor for vapes at Gen Z level was whether the device had a screen that you could play games on. You know what I'm saying? So I think the reality here is all-in-one and devices in those formats, big lens thinking, will outgrow the kind of dab rig nature use case.
Okay, very interesting. Okay, let's move to another category that I know you have quite a bit of insights into, which is the edibles category. And this discussion will only concern Australia because for now, European markets like the UK and Germany have very, very limited pastille offerings. To be fair, completely non-existent in Germany, except for some magistrally produced extract cubes and similar. And in the UK, there's a few references, but very, very limited. Only the Curaleaf ones that come to mind immediately. But in Australia, over the last 2 years, we have seen the pastille category, which is what in Canada you would call a soft chew, for the most part, has been increasing. One of the highest, one of the categories that has been growing the most in the Australian market, with over 20% of authorizations, SASB authorizations at one point, being for these products. And when we checked this data, I believe it was earlier this year, we had over 100 SKUs of these products. And something interesting is that rather than, let's say, the innovation in the domain has also arrived, well, in two different directions. One is in the infused with more premium concentrates. This is mostly rosin, but also resin-infused pastilles. And then, interestingly, so something that might be arriving in the UK, but I'm still not sure, but some products are starting to be labeled, are this triple labeling, no? So instead of just THC CBD, now we have THC CBD CBN or THC CBD CBG, and even some other types of minor cannabinoids, but mostly these two, CBG and CBN, which would more or less be like the day product and night product a little bit. And we have clinical data showing that it is the case and that these minors can impact that. And we see in the available menus that upwards of 20 to 25% of the products in both the balanced and the high THC segments of the category already incorporate either this rosin infused or these minor cannabinoids. I believe there's 2 SKUs that have even both, that are rosin infused and are also labeled the CBG, as are also formulated with CBG. So Pete, I know you have also been involved in this segment in the Australian market. So do you think, well, I need to ask, is this a loss of is this a good use for live rosin? Is it a marketing ploy? Like what do you think of this premium segment of the market developing in Australia?
So I think firstly, the huge growth at which you see there in sort of the premium dominance is definitely a play on marketing for sure, to kind of capture that initial growth. Because if you go look at America, In my opinion, the data is a little bit different, and they're a little bit more honest to the product. So what we saw in the Australian market was very clear. We saw big, bold, solventless rosin chewables, okay? But then when you know how the product is made, for the THC component, they use a little bit of rosin, but then they use solvent-derived minor cannabinoids, so solvent-derived CBN, solvent-derived CBG, but on big, marketing, it says solventless, no solvents, hash made, etc., where they clearly put in isolate extracted minor cannabinoids. So I think that initial growth is there. That being said, from the anecdotal evidence of these patients describing the experience with the live rosin, everyone knows that a hash origin product is a little bit more three-dimensional in the therapeutics experience than a distillate or solvent-derived kind of purified product. And so, but especially when you also have it as an edible. So I do believe, though, that the live rosin experience from an anecdotal perspective at a therapeutic level for the patient is showing, and I do believe the patients do prefer it versus the distillate option. So when we look at that growth, yes, it's a little bit of marketing, but I can honestly say the anecdotal experience of these patients feeling the edible version of the hash origin product is literally what everyone's after. It's more of that three-dimensional entourage effect than that kind of doom. It's a standardized therapeutic level controlled experience.
That's very interesting, because a few years ago, I remember there was a lot of talks regarding the nanoemulsions and fast onset effect, specifically for oral dosage forms. And there's some in the market, but it seems that the hash origin seems to be more what patients are after, probably, rather than, or maybe it's a little bit of everything. What do you think?
Yeah, I think from the anecdotal feedback that we've been getting from clients, we believe it's the hash origin. Everyone knows that has used a hash origin product really understands the therapeutic potential of those differences and nuances with that product.
Very interesting. Thank you so much for the insights. We're already arriving at the end, so let's look a little bit into the supply chain corridors, and these are just some examples of the trends. Let's say the Canada remains dominant origin for concentrates internationally, but I must say, if in the flower market 3/4 or more of the supply has the origin in Canada, for the extracts is not as much. It's a little bit less, I would say. And South Africa, interestingly so, has carved itself a little bit of a niche in the extract supply, and in particular with solventless, which I would say you were trailblazing a little bit at the moment, and this has paid off. But of course, we have Morocco, which has been, the monarchy has been pushing very strongly for legalized market, and it's a big bet on their export strategy for cannabinoid products. And of course, because it's very hard to produce flower in Morocco, so pretty much all their exportable production are solventless products. Not that successful for now in international markets. We know that the AMTG claimed to import some hash. There's been, even to South Africa, some hash products imported from Morocco, but those are not super prevalent in the menus of international markets. In the CBD market, it might be a little bit different, and also, in the legacy market, despite the fact that a lot of the production in Morocco is now licensed, it seems that it's still the main destination of Moroccan products. And then we have other origins like New Zealand in some cases, and we could also mention like Colombia, like in multiple countries. Solventless production is emerging, particularly in the global south, I must say, looking at this. So in your opinion, Pete, what's the reason that South Africa has carved this little niche in the international market with solventless, and what are the advantages of South African production in this more and more competitive international market?
So yeah, I'm going to be a little bit biased here, right? So when we set this up 3 years ago, we said we need to partner with a cultivation business that has no dryers on site. The only way you can win with quality hash, bubble hash, and live rosin production, you cannot be distracted by selling dry flower. If you are half in, half out, you will lose all your money. So you have to have a dedicated cultivation zone specifically manufactured and aligned on making live rosin. So we produce, a specific cultivation pathway, which means that, for example, other players or other origins, right? They are producing the flower and maybe they don't sell the flower, or maybe they get an order for rosins. Maybe they take a quarter of the greenhouse, flash freeze it. Maybe some of the dry flower doesn't get sold. So they're like kind of, quickly make it into dry bubble hash, cured bubble hash. Where for us, what we've done is said, we are all in. No dry is allowed on site, so we will never be distracted by dry flower, which means the cost of efficiency into our process is all in one direction. Whole plant, bubble hash production. When you have this mindset, you are able to tap into all the markets at a high quality at the relative cost that you need to be. So that's why the supply chain, if you can have a supply chain that's aligned strategically into exactly what you want to do, we believe you'll dominate. But if you have a dryer on site and you're deciding whether to do hash or to sell dry flower, you will lose a lot of money.
So
and you just won't build you just won't build the momentum of supply. I mean, we've only just got it started, right? And we, very much in the marketplace.
So streamlining production is very important, no? For you reckon for the future of extracts to make them cost effective.
Everyone knows how bubble hash is made. The yields are, you can't be messing around with the yields. You can't be messing around with the genetics. It's a very finicky process. Now, on top of that, you're saying, okay, well, I'm going to maybe sell flour and maybe sell hash because I can't sell all my flour. The price is really bad. You're going to lose in both markets. So you have to be all in.
Very interesting. So I wanted to nail down a little bit more also on the producer economics, and something that caught my attention before is, of course, it could be the big phrase for this webinar, which is you're expecting the future to trend towards the diamonds, you could say, based on this potency and price equation. And this data is based on the OCS data from Canada, but you see a little bit of the value ladder. And of course, live rosin remains the top, because probably in terms of process, it's the more expensive to generate. Of course, GMP production has also a premium that can be very big at the beginning, as we saw before in the case of the UK, but over time, it might also, commoditize, of course, as many producers enter the market. And also, I heard you, Peter, recently you were writing on LinkedIn about the importance that you are, it's important to have good quality, but that you think that it will come down to the price per milligram, essentially at the end of the day. So what's your view on that, and why can you reiterate a little bit why do you believe that diamonds, because the data here is per gram, but of course per milligram, the advantage of diamonds, which are 90% THC plus compared to 70 something percent for rosin, it's of course even more drastic. So yeah, what's your view on the importance of producer economics?
Okay, I'm going to take another bigger lens here. Okay,
yeah.
So zoom right out. We're going all the way back. What is the plant biologically producing in its glands? It is producing THCA. That is what everyone is after at an agricultural perspective, right? So when you look at agricultural perspective, you are designing a greenhouse, a cultivation plan to do the lowest cost possible of THCA. That is what you are after. And so if you could have that throughout the entire chain, from cultivation to processing, that is the moat, in our opinion, because the whole industry is governed by the biological constraint of the plant to produce THCA. Now, I believe that's the moat, because if you look at THCA, it allows it to decarboxylate into any fashionable product, edibles, vapes, everything. Not only that, you get a high price. Have we lost you?
No, I'm here. Go on. Sorry.
Okay. So not only that, but you get a high price, or sorry, a high potency. So, you just got to look at America once again. Look at that market. All the pre-rolls now are infused with THCA powder, every single one. All the hash is adulterated with THCA. Most of the edibles are now manufactured with a decarboxylated THCA. These businesses in America have got combine harvesters extracting 20,000 pounds a day just going for THCA because they understand that that's the moat, right? You got to produce it at this price, and that's the moat. So when you have that lens of the biological constraint of what you're actually trying to do, which is what the patient is actually getting their hands on, THCA, you optimize for that, you have a moat, and you can do anything else. Obviously, you got to be smart in the process and the technique and where you're going with this. But that's the contrarian bet that we are doing and kind of putting our eggs in the basket.
But one devil's advocate might say, like, why do the solventless process at all if the importance is purely on the cost per milligram of THCA? Why shouldn't we all produce crude oil, and at the massive scale, or even massive CO2 extraction facilities? What's the advantage of the solventless process in Iran?
So this is the good one. If you look at the trends and the CAGR growth of each product category, distillate, resin, and rosin, you'll see that distillate and resin market growth is negative year on year. It's losing market share to rosin. So if you can design a solventless process that gets you to 99% THCA, so mechanical THCA, you have live rosin as a byproduct of that process. So not only do you build the moat, but you capture the future growth of this fashionable trend that we are seeing now with solventless live rosin vapes.
So you make the diamonds, but you also make the terp sauce, you mean, with the same process?
Exactly. So, no one knows this, but you can make THCA using mechanical techniques. Obviously, you need to know what you're doing, and we have a little bit of proprietary kind of knowledge and stuff, but if you can figure this out at mega scale, and I'm talking scale of 5 kgs at least a day, you're in the money. Yeah.
Amazing. Okay, we're getting to the end of the webinar. Thank you so much, Peter, for all the insights. This has been a great conversation, and I think we covered quite a bit of ground, and also an international perspective that where are you getting it otherwise, unless with Cannamonitor, honestly. Let's go real quickly before going to answer a couple of questions that were here. There's somebody that's saying that great webinar so far, and so on. First, maybe a quick question by myself. I know that you have already said that you think that the vapes are the big driver of the concentrates, but even now that we are seeing, for instance, in Australia since a couple of years ago, in Germany in the last year, and in the UK in a few months, do you think that concentrates can become established medical pharmaceutical category, same as flour, or you think that it's all going to go to manufactured products?
I believe it can, and I have seen some innovation in the US that standardizes the dose, and I think there needs to be a little bit more work. I think we're like probably 12 to 18 months away from a standardized dose perspective for concentrates, really, because you go speak to the pharmacist who needs to compound this product. How's the patient going to get a standardized dose? And I've seen some really interesting kind of not so harmful to the environment kind of use cases. And I think those are getting nearly there for adoption, but they're probably 12 months away. So yeah, it will come.
Okay, interesting. Okay, and then Daniel Purkis is asking, is there a chance for cured, freeze, dried hash to be accepted into the market? I don't understand the cured freeze.
No. So, how's it, Dan? Shot for watching, bro. Yes, definitely. So cured, freeze-dried hash will definitely be accepted into the market. The biggest risk here is microbiologicals, right? As soon as you freeze-dry something, and it gets into the moisture or the air, that stuff just sucks all that air up, and your CFUs are just going to, skyrocket. So we see a place for it for sure, but we see probably an irradiated space for it, which is obviously not really what you want to be doing. So the packaging, the transport, everything, the cost to get it to market at a freeze-dried level, we believe, from our experience, maybe not worth it, especially freeze-drying it.
Okay, amazing. Okay, we have exhausted our time. Thank you so much again, Peter. Of course, this conversation gonna stay uploaded on LinkedIn. We're also gonna post it on YouTube. So let's stay tuned for next editions of Cannamonitor webinar. Thank you so much, everybody.
Cool, appreciate it.